Lymphedema risk reduction.
Hello and welcome back. So let's talk about if you are at risk for developing lymphedema, what can you do? So first, are you at risk? So a couple things that may make you at risk for developing is if your lymphatic system is insufficient. So if you have been diagnosed with cancer and you've had surgery and a possible lymph node removal or any type of trauma to the breast, the arm, the groin, whatever it may be, this may put you at risk. And if you have had radiation therapy or chemotherapy, this is also could possibly make you at risk. So of course, talk to your doctor, your therapist, but this video will give you a few guidelines of how you can minimize your risk and how you can help yourself.
In this video, I will discuss lymphedema risk reduction techniques for traveling, for developing healthy habits, and avoiding possible triggers. Let's first start by talking about considerations while traveling.
So you're planning on going on a trip, that's awesome, but let's be safe and let's think about a couple tips that will help you to reduce your risk of developing lymphedema from this trip. So the first thing I want to talk about is being on the airplane. So when you're up in the sky on the airplane, the atmospheric pressure is less. So it is recommended that you have some external pressure, like a compression sleeve, a glove, a gauntlet, or a leg stocking to help to compress the whatever limb is at risk to help to move the fluid. So similar as you go higher up, so when you're on the moon, obviously you're floating, so the gravity is not pulling you down. So it really helps to have something externally help move the fluid. So that is number one. Number two is if you're sitting in the car or you're on the plane for a long time, it's very sedentary. So you're sitting there, you're not doing much. So I would recommend that put a little timer if you can for every half an hour. Either get up if you're on the airplane, go to the bathroom, walk around if you can. If you're in the car, maybe lift the arms up, do some pumps with the hands, some toe lifts, heel lifts with the feet. So just start to get moving a little bit more, just so that you're not sitting in that one stagnant position. Because as you know from the other videos, the more muscle pump, the muscle contraction helps to move the fluid through the vessels. So that is number three. So that is number two. So number three, carrying luggage. So often if you're carrying a big bag that has a big strap, heavy pocketbook or something, that strap over here can disrupt that lymphatic flow. So I would recommend that you use a rolling bag or you have somebody help you, or maybe pack a little bit lighter if you can. I know that's hard, but just watching the way that you're doing things as you're preparing for the trip. And lastly, you want to make sure that you stay nice and hydrated, because if you're not having enough water, enough fluid through the body, it disrupts the capillary pressure from the blood, so it just disrupts the overall flow. So staying hydrated before, during, and after will help you to feel better as well.
Let's talk about some healthy habits to reduce your risk.
So what are some ways that you can help yourself right now to get in a better habit of healing and of reducing your risk? So number one is skincare. So those lymphatic vessels are right underneath the skin. So the more you keep the skin hydrated, the happier the vessels will be. So I would recommend applying lotion once or twice a day, depending on how dry your skin is. Secondly, it's another topic that we talked about last time, so hydration. So you really want to make sure that you are well hydrated or have the appropriate amount of water intake that your doctor tells you to. Third is you really want to focus on your stress reduction and stress relief. So this time can be a really stressful and overwhelming time. So trying to keep up with really bringing yourself back down, grounding yourself through either my videos, the yoga meditation practices, or your own practice. And the fourth healthy habit that I would recommend is exercise. So as you know, through our first video of our lymphatic system overview, the lymphatic system really loves that muscle pump. So we really want to promote an exercise routine weekly, daily, however much you can do. So walking, swimming, yoga, Pilates, whatever is your interest, even weight training if appropriate in your plan of care. So exercise is a huge one as well.
What are some things that we can avoid to decrease our risk?
So let's talk about what could be potential triggers. So if your limb is at risk, say your arm, your leg, whatever it may be, there's a couple things that you can watch out for so that you can prevent or reduce the risk of developing lymphedema. So the first thing is limb constriction. So you want to make sure that anything you're wearing is not constricting in anywhere weird. So any really tight clothing that may constrict here, like a forearm sleeve, or if you're wearing a really tight bra that might build up through here. So compression is great, but when it's recommended and fit to you. So just be careful if you have any type of bra that really digs in, that can impact the flow of the lymphatic vessels. So if a bra is digging in right here, it might not allow that drainage to go down to the inguinal nodes. So just avoiding anything that's really uncomfortable and could potentially constrict areas. The second topic is avoiding extreme temperatures. So lymphatic system gets all out of whack when it's introduced to really high or really low temperatures. So I would avoid anything like a hot tub or staying in the shower with really, really hot water for a long period of time. Being out in the sun, make sure you have a little cooler with a like a little face cloth you can wrap around your neck to stay cool, or one of those fans. So trying to keep your body temperature at a good level state will help to not overwhelm the lymphatic system. Third is something we've talked about a lot, is avoiding prolonged inactivity. So not sitting for an extended amount of time. It's recommended that every about 20 minutes you either just stand up, or you move your legs around, or you move. So trying to avoid staying stagnant for a long period. And lastly, avoiding any injury or trauma to that limb, which sounds kind of common sense, but it might come in handy to keep in your mind when you're at the doctor's office. So if they go to do blood pressure on your potentially at-risk arm, have them do it on the other arm. If they want to start an IV in the hand or in the arm, have them doing it on the other arm. Also, if you're an avid gardener, or if you like to do a lot of yard work or anything like that, protecting your hands, wearing gloves, and making sure that there's no cuts or injuries to that limb. If there is, by any chance, you do get a cut, then make sure you clean it out really well. Just make sure that you keep watching it to make sure that an infection does not happen. Thank you.
Thank you so much for joining me. If you have any questions, please comment below or speak to your doctor or therapist for further guidance to reduce your risk of developing lymphedema. Thank you. Namaste.